We know starting treatment can be overwhelming. This short video will help you through your first infusion appointment. It will prepare you so your visits can go as smoothly as possible. When you arrive, there are two options for parking at Strong Memorial Hospital. You can park using our Wilmot Cancer Center valet service at 90 Crittenden Boulevard or in the main hospital garage. If you park in the hospital garage, you can follow signs to the Cancer Center once you enter the hospital. Before each infusion visit, most patients need blood work drawn for lab work. If you have a port or central line, you might have a separate appointment in the infusion center for a nurse to draw blood for testing. If you don't have a port or central line, you can go to any URMC lab. You may get the blood work done up to 3 days before your infusion. If you wish to get your labs drawn on the same day, you must use the Cancer Center outpatient lab located in the Cancer Center lobby. If your labs are being drawn the same day as your infusion, please arrive 1 hour early, as it takes time to receive results. We can only prepare your chemotherapy once we have received the results from the lab. Many patients will see their oncologist on the day of their infusion. If you are one of these patients, check into your clinic appointment after completing your blood work. If you don't have a clinic appointment, check into your treatment at the infusion center front desk. We schedule each appointment separately, so please make sure to check in individually for each one. When you check in to the infusion center, secretaries will note your arrival and give you an ID bracelet with your name and date of birth. They will also provide you a parking voucher if you park in the garage. When your nurse is ready for you, a patient care technician will call your name and take you to the center. They will take your temperature, pulse, and weight and ask you how you're feeling. They will then take you to your pod. The infusion center has 9 pods, each with 4 to 6 patient chairs. Our pods are marked with letters A through I. The letters help everyone distinguish between the pods.
When you arrive at the pod, there will be 1 patient chair for you and 1 for a visitor if you have one. You can bring 1 visitor with you. Unfortunately, children under 14 are not allowed. We understand that it can be challenging to have a different nurse for each treatment visit, but we want you to know that we carefully select our nurses for their expertise in oncology, chemotherapy, and biotherapy administration. So you can rest assured that you're in good hands no matter who your nurse is on any given day. Your patient chair has a call light for you to push anytime you need assistance. It is also a remote control for watching TV during your infusion. There are curtains you can pull for privacy. Consider dressing in layers as you may become chilled. We also have warm blankets available. Your IV pole is on wheels, and you will take it with you to the bathroom if you need to use the restroom during your infusion. We have basic snacks and drinks, but feel free to bring your own food and beverages, especially if your treatment takes several hours. You can also purchase food at the cafeteria or the Cancer Center Cafe. Once you are seated, your nurse will access your port or central line if it is not already accessed, or place an IV in your arm if your treatment requires it. Consider wearing short sleeves if you need an IV in your arm. If you have a central line, such as a port, consider wearing a button-down or V-neck style shirt. Some patients receive pre-medications before their treatment. These medications are given to prevent specific side effects such as nausea and are given intravenously or in pill form. Sometimes these medications can make you drowsy. We suggest bringing a driver with you until you know how you'll feel. Please bring any of your home medications with you and take them as prescribed by your provider, but let your nurse know before you take any of these medications.
After your arrival, the infusion nurse and pharmacist will review your lab work and vital signs for the day. Preparing your medication can take up to an hour even after your labs have resulted, because it is prepared in a sterile manner and might need to be thawed, mixed, or reconstituted, and then double-checked by 2 different pharmacists. The medical team customizes chemotherapy for each patient and cannot be prepared ahead of time. If you are currently enrolled in one of our clinical trials, please note that this process can take even longer due to additional steps and checks required to prepare these medications. Your study coordinator will be able to answer any questions you have about your particular clinical trial. We offer the Fast Track program to patients interested in a faster infusion experience. Fast Track patients get their labs drawn several days in advance so that we can prepare their medications ahead of time. If you are interested, please ask your clinic nurse if you are eligible. Infusion treatments can take a long time. You might feel like nothing is happening while you are waiting in the waiting room or in your pod, but the nurses and pharmacists are behind the scenes reviewing your lab work and preparing your medication. Your safety is of utmost importance to us. We appreciate your patience.
When your medication arrives from the pharmacy, your nurse will prepare your infusion. If you are receiving chemotherapy, your nurse will wear a blue gown and gloves, which helps protect the nurses from repeated exposure to chemotherapy. 2 nurses will review your treatment, and we will verify your name and date of birth on your medication label with you before starting your infusion. Most people don't feel sick during their infusion, but if you do, please inform your nurse immediately.
Your nurse will review more of the details of your treatment and ways to manage potential side effects. Be prepared to pick up any prescriptions for home ordered by your doctor. Being on time or a few minutes early to your scheduled appointment is essential. The infusion center sees many patients each day in a limited space, so we appreciate your timeliness. We do our best to get your treatment started promptly, but might not be able to accommodate an early arrival. Likewise, we may need to reschedule if you are more than 20 minutes late for your appointment.
If you still need to set up MyChart, please ask us how. It's a great way to communicate with your team regarding non-urgent medical questions and review past and future appointments.
We know this time can be scary and overwhelming for you and your family. Knowing what to expect at your infusion appointment will help. We look forward to providing you with the best care at the Wilmot Infusion Center.